Here are 10 things you probably didn't know about Crohn's disease. Number 1. There is currently no known cause of Crohn's disease. Most researchers believe that contracting Crohn's disease has something to do with the combination of your genetics, environment, and immune system. Number 2. Surgery is likely. For most people who develop Crohn's disease, surgery is a question of when, not if. And although drastic, surgery is not a cure to Crohn's disease. It's just a temporary solution to keep the disease under control when medication alone is not enough. And even then, it doesn't always make a significant difference. About 20% of patients who undergo surgery go back to experiencing the same symptoms within 2 years of the operation, and about 80% of patients experience them within 20 years of the operation. Number 3. Symptoms of Crohn's disease most often show up in adolescents and young adults between the ages of 15 and 35. Only 15% of Crohn's disease victims are elderly, and unlike most illnesses, they are far less likely to experience complications than younger patients. Number 4. Unfortunately, there is no cure for Crohn's disease. There are, however, treatments that can alleviate the symptoms and prevent malnutrition. In rare cases, treatment can push the disease into a long-term remission phase, but for most people affected by Crohn's disease, it's a lifelong struggle. Number 5. Crohn's disease is sometimes known as an invisible disease because most patients look and act completely fine and normal. Most of the symptoms are internal and relatively easy to hide, like abdominal pain, cramping, diarrhea, or loss of appetite, to name just a few. When flare-ups occur, symptoms can be harder to hide, but for the most part, victims of Crohn's disease are hard to pick out from a crowd. Number 6. Crohn's disease is more common than you might think. Crohn's disease is one of 2 inflammatory bowel diseases that together affect 1 in 200 people in the United States. Number 7. Crohn's disease can be filed as a disability if it impairs your ability to hold down a regular job. For those who qualify, the Social Security Disability Insurance, also known as SSDI, or the Supplemental Security Income, also known as SSI, provide monthly payments that can go towards regular expenses, bills, or medical care. Number 8. Patients of Crohn's disease can experience both flare-ups and remissions. Flare-ups are when symptoms are at their worst, and they're often unpredictable and can vary in intensity. During remission phases, symptoms are mild or non-existent, and most patients feel normal. Number 9. Fatigue is a significant symptom of Crohn's disease. Fatigue describes the feeling of being constantly tired, weak, or even exhausted. In this case, fatigue has very little to do with the amount of sleep you get. One reason fatigue is such a common symptom of Crohn's disease is that it's a side effect of 2 commonly prescribed medications for Crohn's disease, methotrexate and azathioprine. Some studies have shown that fatigue bothers patients more than the bowel symptoms of Crohn's disease. Number 10. Crohn's disease is an expensive disease to treat. In a study conducted in 2008, the average medical costs for one patient was over $18,000 per year. For more severe cases of Crohn's disease, costs averaged over $60,000, and the top 2% of patients were paying more than $300,000 per year. I hope you enjoyed that video. Comment below if you've had experiences with Crohn's disease. We'd love to hear what you have to say. Thanks for watching.